chaos of an emergency room. One of the toughest things to deal with, a traumatic brain injury, or TBI. You've got to figure out what's going on inside someone's head, and you need to do it fast. Well, we're about to dive into how that whole process is getting a major upgrade, moving from just what we can see on the outside to what the body itself is telling us.
So what's the big problem here? Well, a brain injury isn't like a broken bone, right? You can't just see it. It's often called the invisible injury, and for good reason. For doctors in a packed ER, figuring it out is a frantic race against the clock.
And let me tell you, the stakes could not be higher. Getting that diagnosis right and getting it right early can literally be the difference between a full recovery and lifelong problems, or worse. So that begs the question, how have doctors been trying to tackle this whole invisible injury thing up until now? All right, so before we get to the new stuff, we've got to understand the classic tool of the trade, the thing that's been the go-to for doctors on the front lines for decades.
And that tool is the Glasgow Coma Scale. You'll hear it called the GCS. For a really long time, this has been the first thing first responders and ER docs reach for. It's their way of getting a quick snapshot of a person's level of consciousness right after they've been hurt.
It's actually a pretty straightforward system, but it's really effective. Doctors are looking at three main things. First, eye-opening. Can the person open their eyes by themselves? Second, what's their verbal response? Are they talking normally? Are they confused? Or maybe not making any sense at all? And finally, their motor response. Can they do something simple, like squeeze your hand when you ask? Each one of these gets a score, and then you just add them up. So you add up those three scores, and you get a total out of 15. If a patient scores high, say between a 13 and a 15, that usually points to a mild TBI. Think of your typical concussion. That's going to fall in this range, and this is, by far, the most common outcome.
Okay, but what happens if that score drops? If you're in the 9 to 12 range, things are starting to get more serious. Now we're looking at a moderate TBI. It means the injury is having a much bigger effect on how conscious the patient is.
And then there's anything below an 8. A score that low means we're in severe TBI territory. This is life-threatening. The person might not even be able to breathe on their own, and doctors have to jump in right away. This is the red alert zone.
But here's the catch, and it's a really important one. The GCS is fantastic for figuring out someone's level of consciousness. What it can't do, though, is tell you what's happening to the actual brain cells. It's blind to the biochemical damage happening inside. And that can be a really dangerous blind spot.
So the GCS gives us the big picture of how someone's functioning, but it doesn't show us the damage to their brain cells themselves. So how in the world do you see that? Well, it turns out the answer isn't in the head at all. It's in the blood.
Okay, so meet our two new heroes. A couple of biomarkers named GFAP and UCH-L1. Now here's how they work. When brain cells get injured, they release these specific proteins into your blood. GFAP comes from one type of cell, showing structural damage, and UCH-L1 comes from the neurons themselves. It's like they're sending up little flares, or maybe acting as tiny detectives, telling doctors, hey, there's an injury here, and this is the kind of cell that's hurt.
And here's what makes this a total revolution: the speed. We're not talking about sending a sample off to a lab and waiting for hours. No way. We're talking about a small, portable device that can spot these biomarkers from just a drop of blood, and it can do it in minutes, right there, in the ER.
Okay, so this is where it all clicks into place. You've got the old school clinical know-how on one side, and this brand new, super fast blood data on the other. So the big question is, how do you put them together to see what's really going on?
Let's run through a quick scenario. This will show you just how powerful this combination is. All right, so imagine a patient gets brought into the ER with a head injury. The medical team does their thing, they run the GCS, and the score comes back as a 14. Now, based on what we just talked about, that sounds like a mild TBI, right?
In the past, a GCS of 14 probably meant they'd watch you for a bit, then send you home. Just a minor concussion, they'd say. But is that really the whole picture?
But here's the game changer. The doctor also does that quick blood test, and in just a few minutes, the results are in. The patient's GFAP and UCH-L1 levels are high. Whoa. Suddenly, the blood is telling a completely different story, a much more serious one than the GCS score did.
And that's the new process, right there. Those high biomarker levels are like a huge red flag, a warning system that screams, there might be a bleed or swelling inside, something the GCS score could never have picked up on. So what happens? The patient gets flagged immediately for a CT scan so doctors can get a real look at what's happening inside their brain.
So you see, this isn't just about tacking on one more test. It's about completely rewriting the rulebook for diagnosing these injuries.
And really, this quote just says it all. The future isn't about choosing one or the other. It's about integration, combining that hands-on clinical assessment with the hard data from these point-of-care biomarkers.
When you put these two things together, you step into a whole new era of care. It's faster, it's way more precise, and bottom line, it's safer, because it finally helps doctors see that invisible injury.
And it really makes you think, doesn't it? If we can get this kind of life-saving information from just a few drops of blood for something as complex as a brain injury, what's next? What other medical mysteries could we unlock with this kind of super fast, on-the-spot technology?